Mr. Cohen, in general, what is happening to the insurance premiums, the gross premiums now, not after taxpayer subsidy? What is happening to the insurance premiums of young, healthy individuals under the Affordable Care Act?
I think they vary a lot from state to state and even within a state, region to region. I don't think it's possible to make a broad general statement about that.
Well, I would like to enter into the record, I guess it's the Republican staff of the committee has put together a summary sheet of what's happening. And I can say, for example, in the state of Illinois, somebody 27 years old, a male, is going to experience about a 104% increase, female about a 42%.
Could you clarify, though, is that with subsidies or without?
That'd be the gross premium.
That's without subsidies,
Yeah.
but the bill has subsidies in it, so let the record reflect that.
In other words, yes.
So we won't be confused.
So the point being is the only way that anybody is going to, not the only way, but one of the prevalent ways that people actually see their share of health premiums reduced is because taxpayers are going to subsidize their care. In Wisconsin, let me finish, Madam Chair. In Wisconsin, the cost of a male 27 years old will increase about 125%, a female about 77%. And a lot of that has to do really with the fact that we're community rating. We're limiting the insurance premium rate on older, sicker individuals, and we're increasing the premiums, making younger, healthier people pick up that burden, right? Isn't that correct? Isn't that redistribution?
Well, I think what we're hoping to do is increase the number of younger people who are actually covered, because the rate of coverage
right, so they can come in the pool and pay a lot more than they were currently paying in the individual market, correct?
What we're doing is we're expanding the risk pool so that we can spread the risk across the whole population, and that's the idea behind the law.
Mr. Cohen, let me ask you, as an expert in CMS, when did you realize that what the President was saying, that if you like your health care plan, you can keep your health care plan. If you like your doctor, you can keep your doctor, period. When did you believe that ever?
The law provides that issuers could continue plans as grandfather plans as long as they wanted to into the future,
well,
and so that the law was designed to enable that. What the President said to be true, and it really was up to the insurance industry to make decisions as they have in the past.
Let me explore that. My bill, if you like your health plan, you can keep it act, uses the President's exact same language in the bill. The problem with the President's the grandfather clause in the Affordable Care Act is said, yeah, you can keep your plan as long as you totally change it. What we did is we took out the as long as you totally change it. We didn't force some of those initial essential health benefits onto those plans. So the fact of the matter is you couldn't keep your plan unless you changed it.
Grandfather plans are not subject to the essential health benefit requirement.
But there are other things that they are subject to. Guaranteed issue, maximum. No lifetime maximum.
They're not subject to guaranteed issue. In fact, it's quite the opposite. You couldn't add you can't add more people onto a grandfather plan under the law.
I'm not asking to add more people.
Well, guaranteed issue, that's what you're talking about.
Well, okay, lifetime maximums. We'll get you the list of the changes required in that grandfather clause, because we extracted that in my bill. But anyway, getting back to my question, did you believe that if people liked their health care plan, they'd be able to keep it across the board, that nobody would lose their health care plan if they wanted it?
I believe that the law provided an opportunity for insurance companies to have grandfathered plans, which would make the President's promise to be true. And it was also true that the large majority of Americans who have employer-sponsored coverage through large employers were also able to keep their plans.
But every American? I mean, for example, did you realize that state high-risk pools, like in Wisconsin, that covers 22,000 Wisconsinites, did you believe those things would still be available after the implementation of...
Before the Affordable Care Act, every American wasn't able to keep his or her health plan. You could lose it. You could lose it if you got sick.
Listen, we are talking about the promise made that if you like your health care plan, you can keep it. I've got a couple in Wisconsin, both cancer victims, that have been dropped, will be dropped from the high-risk pool because it becomes obsolete January 1st. You knew that as a health care expert, correct?
The law did not require states to drop their high-risk pools. The law allows states to continue their high-risk pools. So I don't think that is a requirement of the law. That was a decision that was made by the state of Wisconsin.
You knew those things would be gone. You really believed that every American would be able to keep their health care plan and their doctor. You believe that to be a true statement?
There's nothing in the law that requires anybody to lose their doctor.
I'm just asking you whether you believe that.
I believe that the law contained provisions that would enable that to be true, but it also is a private market solution. So it is not government-mandated health care. It's up to insurance companies what products they offer in the marketplace. Insurance companies were given the option, the ability to maintain the existing plans as grandfathered plans, and if they do that, people are able to keep those plans. That's a choice. That's a choice.
Are you surprised millions of Americans are losing the health care plan? Are you surprised by that?
Well,
are you surprised? Just yes or no. Are you surprised millions of Americans?
I'm not surprised or unsurprised. I didn't have an opinion as to what the market would do. I knew what the law provided.
Senator Johnson, thank you for sharing such clarifying comments. Senator Booker?